Welcome to the session on basics of smart healthcare. So today in this session, we will learn about why there was a need for smart health, what is smart health and what is smart healthcare. Patients feel hospital visits are long waiting time, huge crowd and queues, less time by the doctor because doctor is so busy with so many patients, not able to get medicines and get the lab test on the same day. On the other hand, for the doctors and the health professionals, records are not available for the old treatment. They have to wait for that because the lab reports take time to reach when it is done manually. Patients are not able to communicate with the doctor because time is very less. In these cases, doctor is not able to make evidence-based decision due to non-availability or incomplete records. Patient is not able to share the decisions because time is so less to communicate with the health professionals and the doctor. In that concern, patient is not satisfied with the treatment because diagnosis and treatment get delayed. Referral system is very poor, hardly any follow-up at home in the routine system. After discharge, patient is not able to get consultation regularly. So, the smart health was the solution which incorporated new generation information and various changes took place. Previously, we had oriented medical or hospital system as medical model care, which changed from disease oriented to patient oriented care, clinical information to health information system, general management to personalized management of the patient. You can see the changes we will discuss over time. So, advancement in technology has changed the global healthcare. Smart healthcare uses a new generation of information technology, including artificial intelligence and big data. So, what is smart healthcare? Smart health is an open standard-based technology platform that helps to create apps that work effectively and are safe across healthcare system. Means they are all technology based, which are very effective. They are safe to transmit the data and the reports in the health system. The concept of smart healthcare originated from that of Smart Panel, first proposed in 2009 by IBM. That is, Smart Planet is an intelligent infrastructure that uses sensors to process and transmit the information, because here patient data, records, reports are to be transmitted to the doctor, and these are transmitted to Internet of Things, processes information using supercomputers and the cloud computing. I hope you can understand the processes. According to Tian, smart healthcare is not simply technological advancement, but it is an all-round, multi-level change. Transformation will help to move toward patient-centered approach and focus on preventive care. Previously in the medical model, it was care, disease-oriented, treatment-oriented. Patient was at the bottom. Now here the patient is the main priority. Smart healthcare involves human and non-human participants, that is doctors, nurses, patients, hospitals and research institutions. It comprises new technologies together with biotechnology, that is artificial intelligence, Internet of Things, medical Internet of Things, edge computing, cloud computing, big data, next generation wireless communication technology, along with the modern biotechnology advancements. Now let us try to understand what is smart healthcare. Smart healthcare is an integration of fragmented healthcare delivery mechanism. It utilizes electronic patient records and streamlined processes with the aim of improving the quality of people's life by reducing health risks and improving their well-being. That means previously the healthcare what patient was getting, diagnosis, treatment, reports were not available in time. Maybe once doctor is seeing, maybe senior doctor, previously next time the junior doctor will be observing. It was fragmented, the referral system, reports and records were not available with the referral doctor. But here, with the utilization of electronic devices, with the technology, records were and the patient's reports were streamlined with the processes. Patient-centric services such as remote monitoring, checks and customized to the patient individual needs and have a wider reach. That means what is the personalized need of the individual patient? What is the treatment protocol? What are the alerts when they have to come for follow-up? All these had the monitoring devices and alerts were there so that every patient have a personalized care which actually have the access to the healthcare at the remotest point. Smart healthcare is a health service system that uses technology such as wearable devices, Internet of Things and mobile internet to access the information, connect people and the professionals, materials and institutions related to healthcare, and then manages and respond to the need in a very intelligent manner. Smart healthcare involves multiple dimensions including prevention of disease, promotive aspect, monitoring of the patient, diagnosis is done in time, patient is able to get treatment in time, treatment not at a point of care but also the referral services at the suppose the patient is in some small town and they had a complication. They can reach out to the best specialist and expert not only in our country but even outside the country. The referral system is very effective. All the reports and the records can be transmitted to the referral doctor and they can give the advice. Hospital management decision making has become very effective because the administrators are able to get data on one click. They can make evidence-based decision and medical research, the data, the patient, what is the, you can say statistics or indicators for the big quality, cost effectiveness, the medical research can be done. Information technologies, for example, IoT, mobile, internet, cloud computing, big data, 5G, microelectronics and artificial intelligence together with modern technology constitute the smart healthcare. Here you can see the technology is used with the modern biotechnology to provide quality, cost-effective, need-based, personalized care to the patient. That is the biggest advantage. Patient can avail health services sitting at home. I think during COVID, many people have experienced that. Even after COVID, teleconsultation for the basic needs when patient was not able to go out, they were able to reach out to the doctors. The elderly who have chronic diseases, they are able to reach out to their doctor. Alarms are there, sensors are there which help them to continue their treatment and follow up. Now let us see what are the concerns of the patient, doctors, institutions and their perspective. You can see here, there are wearables which patient wear and monitor their health. So self-care is the biggest advantage of the use of technology or the smart health. Mobile apps or mobiles can be used by patients, by the doctor to reach out to the patient or to reach out to the doctor, and doctor can get advice the patients. Teleconsultation, not only with the patient and the doctor, but with the doctor and doctor to get the advice for the best treatment of the doctor. And doctor can have web chats and advice to the patient, what are the consequences, what are the treatment, what are the diagnosis, and how they have to go through. So let us see first smart healthcare patient perspective. Patients use wearables devices to monitor their health all the time, seek medical consultation through teleconsultation, seek medical help through virtual assistants. Nowadays, with the advancement of technology, there are robots and the virtual assistants who help the patients for the basic health care for preventive and promotive aspects. Use remote services from home to reach out to the health professionals and the doctors. They don't have to go pillar and the post or run and waste time and money to reach to the health facility. Now, what is the perspective of the doctor? Clinical decision support systems are used to assist and improve diagnosis, treatment and follow-up referral. So let us see what is clinical decision making system. These are the tools, include order sets created for particular condition, like if there are diabetic patients, there are protocols for basic diabetes, how to take care, lifestyle changes. Recommendations are there, guidelines are there, and database are there that provide information relevant to particular patient. Reminders and alerts about potentially allergies or complications. Alerts are there if patients are missing their dose, if there is any complication. Even now there are devices which connect patient family and the doctor. Suddenly, if patient condition is not good, the family and doctor comes to know and they take care of the patient immediately. Use of mobile medical platform that enhance the patient experiences, because patient get immediate consultation. They do not miss up the follow-ups or the medicines. Compliance to the treatment is good and the patient health improves. So their experiences are enhanced and their satisfaction increases. Precise surgeries are conducted through surgical robots and mixed reality technology. Intel offers a diverse portfolio of technology for development of medical robots, including surgical assistants, modular and mobile robots. So the precise surgeries are there. Now the patient safety is a big concern. So this technology helps the doctor and the health system to conduct precise surgeries without patient suffering any misses or the unsafe surgeries and the less complications. Doctors manage medical information through an integrated information platform. Integrated information system is a combination of software that combine different database from various sources with data, integration tools, visualization and model. Previously, what was happening? Doctor was waiting for the reports from the lab, from the X-ray, from the ultrasound or the MRI department, and they were isolated. But here On the one platform, doctor gets electronic health record of the patient, all the lab reports, all the radiological reports, then they combine and make a diagnosis. Treatment line is finalized with the help of these. Smart healthcare for the research institution. What is the perspective? Use technologies like Internet of Things, machine learning and big data. Nowadays, the concern is cost-effective healthcare because healthcare is very costly. Cost is going high. Government and the private sector both are concerned for the cost. How to reduce the cost? On the other hand, they have to provide effective, need-based quality healthcare also. So, the research can be carried out using various advanced technologies with integration with the data from the hospital to improve the utilization and efficiency of resources. How to use telemedicine and reduce the cost, especially for the patients who are in the remote areas who require preventive health care or continuation of the treatment in the chronic diseases. Enhance self-care. Self-care enhancement is very important. Even WHO and the various international and national organizations put emphasis on the self-care by the patient and the family because they have to be partner in the care. And this will help. What are the strategies to motivate the patients and the family to take care of the health of the patient in home and even in the hospital? This research will help to make personalized medical services available to everyone, everywhere, wherever they are available. Even nowadays, in Health and Wellness Center under Ayushman Bharat, even at the remotest corner, the services are available through teleconsultation. Patients don't have to go for the referral services to the district hospital or the tertiary hospital. For the basic things, they can get consultation through teleconsultation. What are the benefits? This is important to understand. Today, patient wants to have a smooth experience in the hospital because the time is very precious. They don't want to waste time just standing in the queues and waiting for the doctor. They want to utilize their time for their treatment, for meeting the doctor, for discussing their issues. They have various concerns, psychological concern, social concern, and the cost concern. They want to know about their disease. They want to know about the cost of the treatment. They want to know about what is the compliance rate of the treatment. So they want to utilize their time for all these services. Smart technology can transmit the patient experiences. Patient can be more satisfied when they come to the hospital. Let us see how the patient can be more satisfied. Smart parking. When patient comes to the hospital, I think all of you must have gone to the hospital once or the other time. You will see there is a big kiosk. Even for the parkings are full. But there are hospitals where there are indicators using technology where they can park. Which parking is full? Where there is a vacant place to park. So patient will not struggle to park their vehicles. Online appointments. Previously, patient was coming to the hospital, standing in the queues for hours just to have an appointment. But here, before coming to the hospital, patient can have online appointment as per their convenience on which date and at what time they want to go, so that their waiting time reduces. And there are hospitals which, with the online appointment, there is a creation of OPD slip also. Patient will go and directly wait outside the doctor's room. Patient history by robots and update the records. There are various private hospitals in which the robots take the history. And before the patient reaches to the doctor, the basic history of the patient is updated in the records. So the time of the doctor is utilized for diagnosis and prescribing the treatment and talking to the patient. Queue process leads to smooth movement of the patient. Previously, patient has to struggle. If you have seen outside the doctor's room, too much of crowd was there. Patients used to push each other who will go first in the doctor's room. But here, with the queue system, the tokens are given to the patients, and patient will reach to the doctor as per their token number. So patient can relax and sit and do their own work also. Records are available on device. Doctor can reach out to all the reports on a device, on a computer, on a laptop, or on the iPad. Patient have satisfied experience. Do not have to waste time. Reach to various department and complete the process. That means now patient can go to the doctor. Doctor will give the treatment and patient will undergo all the investigation as per their turn and will get the medicines and various other processes patient will be able to do smoothly. Patient medical records and management of the records updated electronically. That means electronic health record and electronic medical record of the patients get updated automatically, because immediately doctor will complete the treatment, diagnosis, what advices he or she has given to the patient will update it electronically. When they go to the lab, what all lab investigations are being done will be checked and clicked. Radiological department will click their own. If they go to the dietitian for the advice, what advices are given by the dietitian, that will be updated immediately, and what is the follow-up advice even will be updated. Medical errors are reduced. Patient safety is increased and assured, because yes, one has to take care. When they fill the information, they should see that correct information, correct diagnosis is been filled, correct medicines are ticked, and investigations, correct reports are uploaded, not by mistake other patient reports are uploaded. In that way, the medical errors can be reduced and the patient safety concerns can be assured. Doctors and nurses can provide evidence-based care. That is important to understand, because here doctors and nurses are able to get the reports in time, records are available with them handy, and they can plan the care accordingly. In case there is any change in the investigation, any change in line of treatment by the doctor, immediately nurses will get the alerts. In case there is medicine is less in the wards, sister don't have to run here and there. The pharmacy will get the alerts and they will send medicine immediately, and patient doses they will be able to get in time. So you can see what are the advantages of the smart healthcare. Improve communication between departments and improve the coordination. Previously, when there was a verbal communication, rather there was a miscommunication,
between the departments, and there used to be lots of conflicts and the blame game was going on. Here electronically, whatever information is to be passed from one department to another, one profession to the other, that was electronically provided in time. No blame game was there that we have not received in time, the order was not correct, and it helped in improving the collaboration. If collaboration is improved, the patient care will also improve. Then improve communication with patients and family. I hope everyone, you must have heard in the news and read in the newspaper, there is a conflict between doctors, nurses, patient and the relatives. Even there was a violence incidences which were reported. If electronically patient diagnosis, treatment, understanding of the patient is clear, patient get good referral system, their doubts are clear, they get timely information, timely treatment, this communication will improve and the violence against the doctors and the health professionals will also be reduced. Bill time is reduced. In private hospital, the billing takes lots of time and patient and relatives has to stand for hours to clear their billing. But here with the smart technology, all the information will reach the billing office in time. When the patient will be discharged, that time and date will reach in time so that they keep ready the billing, the bills, and whatever payment is due, the patient and the relatives will pay in time and they will not waste time standing in queues. Improve referral system, already I have explained, referral system within the hospital with various departments, outside the hospital with other referral tertiary hospitals, even getting expert advice from specialists within the country or outside the country. Hospital information management system is updated and used for decision making by the managers. Now they don't have to rely on the handwritten reports which they waited for hours or for the days to make decision. Here, if they have to change anything, if they have to improve the services, they will get all the reports and records in time. Follow-up care at home is provided. Now patient can, or the patient will be followed up by the health system at the home through this smart healthcare. Because previously what was happening, patient was reluctant sometimes. Why should I go to hospital wasting my time? Whenever I feel like I will go to the hospital. And hospital people were not able to follow up because they were overburdened with so many patients and there were limitations due to various reasons. Use of sensors and devices which raise alarms for complications, actions to be taken not only by the patient but also by the health professionals. In case doctors and nurses are busy or they have some complicated cases, immediately alarm will be arise if something happens with other patient. So that help them to reduce the complication, give care to all the patient and take care of all the things, maybe medicines, follow-up, complications, allergies in time. Patient receives alarms and alerts for various things in time and their confirmation to the treatment is good. Patient assess their own parameters and if they need consultation, if they need any service from the doctor, they can reach out to the doctor in time. Patient and staff are satisfied. When everything is in place, patient get diagnosis and treatment in time, all the investigations are carried out in time, patient gets follow-up care at home, alarms and reminders are there, patient is
able to take care of self at home, family is well educated, given health education regarding diet, lifestyle changes, when to follow up, the satisfaction level of the patient increases. On the other hand, staff is also satisfied because they are able to provide need-based, cost-effective healthcare. They are not being pressurized to reduce the cost or to provide quality healthcare because there are alarms and alerts and sensors which help them not to miss anything. If there are any misses, immediately they can take care of that. Patient records are available in time. They are able to take decisions in time with the evidence. Hospital is satisfied because they are able to reduce the cost. They are able to provide cost-effective care within the limited resources, and when the patient and staff are satisfied, hospital will have a good name. When patient go out, they say this hospital is providing quality care, and the retainment of the staff is also there. Staff will not leave the hospital if they are satisfied. In this way, you have seen how the smart health and smart healthcare can improve the experiences and the satisfaction level of the staff and the patients. Smart healthcare basics will help you to understand why there is a need of smart health and healthcare, how it is beneficial for the patient, for the doctors, for the health professional, for the health institutions. These are some of the references. You can go through these references, and there are various videos which are available. You can go through those to try to understand what is the importance and benefit of smart healthcare. So thank you so much for attending the session on smart healthcare, which will help you to understand what is smart health, what is smart healthcare, and what all technologies are being used with the biotechnology and advancement in the healthcare. Thank you so much.